This is Ketamine, What's Next? Aintree Hospital in Liverpool. Medics are about to welcome their first patient in this brand new dedicated ketamine clinic.
One looks to have cancelled herself already, and she's the one I did speak to on Thursday and said she was coming. I've just finished an on-call run, and we had the biggest number I've ever seen of inpatient ketamine users, and that's young people whose pain can't be managed. We'll find out as we chat to them, but yeah, most of them come to the clinic still taking ketamine.
We've been given exclusive access to film on the ward, specifically to treat patients as demand for help with bladder issues from taking the drug soars.
You've got new hair.
Pink hair, I know.
As ketamine's pushed through the body, it can damage and irritate the bladder lining, leading to scarring. And over time, the bladder can shrink.
Take a seat.
Thank you.
Your bladder is getting better with the time off the ketamine.
Definitely.
You're getting more and more fluid in there, more and more urine in there.
I was in nappies, I was wetting myself, and I had no control, and now I'm also nappies. I wear pads, but I'm also in nappies.
Abby started taking the drug at 20 and was using it for 7 years. After 6 months off it, her bladder is only just starting to recover. And how's your bladder now? You said you're not wearing nappies anymore, right?
I've just recently got out of nappies, and you know what, I am so grateful, because like the embarrassment of having to be in nappies and like trying to hide them over clothes, and like the thought of like wearing them to irritate you, I was having rashes and stuff like that. So the fact that I'm out of nappies is just like, it's a massive achievement, which I thought I'd never get out of ever again.
We've heard stories of teenagers who are maybe in schools who have got access to it. What would you say as someone that's kind of gone through this process?
I was told I was going to have a wee bag. I got told that I was risk at prolapses, being in nappies, and you know what, I didn't believe it would be me. I really thought, okay, you're saying that to scare me and stop me, and you know what, it turned out it was me, and it did happen to me.
Come on down.
Another patient's booked in. He doesn't want us to identify him.
Do you remember what it was last time you had a scan?
He's 25 and last took ketamine back in August, but the break in taking the drug has seen his bladder slowly increase in capacity.
It's staying off the ketamine that's brought your bladder function back up from a bladder of that sort of size to a bladder of that sort of size.
Amber, how often are you seeing teens come here with injuries from taking ketamine?
So at the moment, daily, we've got patients coming in for routine flexible cystoscopy, camera check into the bladder. We have patients coming in for treatment, and we have patients coming in to see the doctor in clinic for the first time.
How much of a problem is this at the moment here?
Massive problem. So when I started just over a year ago in urology, I didn't have any ketamine related patients on my clinics that I do. But now that's just increasing every week.
And are there any particular cases that have really shocked you or you've been particularly surprised to see?
There's one in particular that I can think of who, when we're trying to put the medication into her bladder, we can only get 25 to 30 mils in the bladder before it's excruciating for her.
Wow, so I mean, what rough size?
It's tiny.
Wow.
So about this big.
Wow.
And then obviously the bladder wall is thickened, so that can't expand or deflate anymore like a normal bladder would.
So you've been referred by your GP because of issues you're having with your bladder, is that right? If you continue to keep taking ketamine, it could start to have an impact on your kidneys, in which case we'd have to put tubes into your back.
This 20-year-old's come to the clinic with her mum. She says she's still using the drug almost every day, sometimes up to 7 grams each time, and she's having to go to the toilet a lot.
Absolutely, it's just straight opposite.
And just a few minutes into her appointment, she's off again.